Today we're going to show you how to actually make a provisional in lab. So first we're going to start with the putty. Remember, you need to have something before you prep the tooth, so please don't forget to make this before you prep the tooth. Equal amounts, that's maybe not quite equal amounts. You can see that I'm actually only using maybe a half a scoop or maybe a third of a scoop of each of them. Don't forget that these can't be mixed, because if we start mixing these together, we're gonna end up with one or the other setting up. All right, so I'm gonna pull that out. Remember, this is the situation where when you mix it, and you already saw this in a video, it needs to be completely homogeneous in color. Remember also not to do this. Use your fingers to mix it up. Takes a bit to get all of that marbling out of there. Do it relatively quickly. You have a little bit more time to work with it then once you get it onto your typodont. In this case, during this lab, you're going to be doing this on tooth number 19. At this point, you can roll it up a little bit, make it kind of nice and smooth. I'll kind of actually make it into a bit of an arch shape like I want it to be. You also do this in the mouth as well. I'm going to be doing this for tooth number 20. So at this point, I'm gonna smush it down around here, but also remember, I have to get it mushed into all of those embrasure spots. So as it sets there, it will actually recreate the anatomy that I'm hoping to recreate. Don't push it so thin that doesn't have the rigidity to hold up when you place it back in the mouth or back in the typodont.
But also make sure that it's not too thick that the patient won't be able to tolerate it.
Exactly. And these can always be trimmed if they end up getting too thick. You can trim them down. You need a scalpel blade for it though, which means also not to cut yourself. All right, so it's set up now after about 5 minutes. I'm gonna take it off, make sure that I have accurately reproduced what I was hoping to reproduce. You can see how all of the embrasures are there and accurate, and everything looks good. It's all nice and smooth. At this point, I feel like this is too long and maybe just a little big. So I'm only doing number 20. So do I really need this to come all the way back to the distal? No, so I can actually use a scalpel blade and basically just chop that off. Scalpel blade's your best option here because it's as sharp as it is and it cuts it real quick, real easily. I wanna have at least, I'm gonna do number 20, so I wanna have at least 21 and 19. So I'm also going to trim this back to just the mesial of 21 at this point. Now I can actually see, and if I got these a little too long, into the vestibule, I can actually cut those as well. See how that would be much more comfortable for your patient. I'm just gonna do the other one as well. Okay, so now that's trimmed up, it's real nice and neat. I can make sure it still fits right back on my patient's tooth and in their mouth. This is much better. From the mesial, I can actually see now when I seat it that it's actually seated. That's very nice and a very important thing. All right, so through the magic of TV, now we have a prep tooth on number 20 for a ceramic crown. This would be ready to basically take in to the CEREC lab, and you could scan this now. Prior to doing that, I want you to make the temporary or provisional. Okay, so we've got two guns here. One has a tip that's actually been used. You can tell because there's material in the tip. When you are done with it, if there isn't somebody waiting in line, leave the tip on the gun. This acts as a cap. This material sets up and seals this off. If you just pull this off and leave that like that, this can dry up. This stuff is expensive.
Very expensive.
All right, so that was for demonstration purposes on that. I'm going to use this gun, which already has a nice new clean tip on it. So I'm going to place this.
Wait, Dr. Haslin. You don't have dilube on your typodont.
Oh,
this is a simulation. You don't have saliva to act as a natural lubricant. So you need something to make sure that your temporary comes off and you don't do it 5, 6, 7, 8, or 20 times.
But I like to do it 5, 6, 7, or 8, or 20 times because it gives me more practice, Dr.
Practice is good, but sometimes we want to be more efficient.
Okay, so I'm going to simulate saliva then with my dilube. Remember, my matrix covers 3 teeth, so I probably want to cover 3 teeth and make sure that I get this into the embrasures as well. Okay.
Dilube works very well. Supersep is okay. All other things do not work. Don't use Vaseline, you'll use too much of it. Don't use random soap or something a senior told you about. Use Dilube. You should all have this from your fixed course.
Okay, so I'm ready. I'm gonna start squirting this out. I'm going to put this tip right down on the base of my matrix. This is very similar to making an impression. See how the tip is continually buried, and I'm filling this right up to the top. I don't need it in all the teeth on either side. Just like that. You get about a minute or so, you get a little bit of working time with this, but in this case it's real simple. You can see how it's seated. You can also see right here that there's a bleb of material that has come out near this canine. Shouldn't be an issue. Probably means you're gonna get a good impression or a good temporary. And now we wait a minute or so, and please time this.
As you're waiting, you can express just a little bit of the integrity on your working station or somewhere, maybe on a glove. When this is pretty close to set up, it means that the rest of it in the mouth is probably pretty close to set up.
Okay, so the provisional is done now, mostly. Remember that you don't want to take away your areas of contact. You know you have an area of contact here, and on the opposite side, the mesial and the distal, don't take those off. Most of the time I will trim this while looking in at the intaglio surface. So I can see my margin on my crown. I'm going to trim right in to these areas and smooth this up. There are different ways to do this. You can use an acrylic burr in your slow speed. I like to use Soflex discs, probably not the red one, probably the orange one, and I'll trim just kind of coming parallel to my margin and get rid of all this excess. Sometimes you can use your scissors, but as this starts to get harder and harder, you can trim off the little bits, but you need some sort of a handpiece or rotary instrument. So at this point, smooth it up, make it look like a crown, make sure it fits, make sure you still have contact, polish it up, you should be done.